First, let's welcome Dr. Andy Smith of Novant Health Surgical Associates. Well, Dr. Smith, it's a pleasure to have you back, and we had you on recently when you were talking about the Da Vinci robot. So we're real excited to have you back today, but before we dive into this, I will just reintroduce yourself and tell us a little bit about your education and your background.
Sure. Andy Smith. My first name is Joseph, so people tend to find me that way when they're looking me up on the internet.
Joseph.
Yeah, right. So anyway, but I've been with Novant Surgical Associates now for 3.5 years, coming up on 4 years, which is kind of hard to believe. It's gone by so fast.
It is hard to believe, yeah.
But anyway, and I'm a general surgeon in Brunswick County, and we cover all of Brunswick County.
And tell me a little bit about where you went to school.
Sure. I went to the University of Tennessee for both undergraduate and medical school. The medical school main campus is located in Memphis. So after spending 4 years in Knoxville, I spent 4 years in Memphis, Tennessee.
Mm-hmm. Yeah, great. Tell me, general surgery encompasses a lot. So tell me what it means to be a general surgeon.
Sure. Well, the old saying, years ago was general surgery is the skin and all of its contents. So if you thought of it that way, it was everything. Certainly things have evolved and there's more specialties and subspecialties now in medicine. But as a general surgeon, our role is really to take care of a wide variety of disorders that primarily involve skin, soft tissues, breast, gastrointestinal system, which includes the liver and the gallbladder and the pancreas, colon, and anal rectal diseases.
Wow. Jack of all trades. I'm curious, what interested you in becoming a general surgeon?
Sure, that's a great question. When I was a medical student, I liked everything. I liked the systems, the physiology, the wide variety of things, and I felt like a general surgeon was probably the most complete physician, someone who can understand the physiology and manage patients both medically and surgically, and the tangible nature of being able to fix something with surgery was certainly very appealing.
Mm-hmm. Well, there's quite a variety there too. I bet you don't get bored.
Never.
Well, let's talk about your clinic. Now I know you have several offices and you have a few partners, so let's talk about your partners.
Sure. So there's 5 of us total at Novant Surgical. There's Dr. Tillotson and Dr. DeSandre, who've probably been there the longest.
Long time. Mm-hmm.
And we won't call out years or age. and then Dr. Scallion, and then Dr. Benanati, and myself. Mm-hmm. We all certainly practice a wide variety of general surgery. Some of us have certain things we're a little more interested in than others.
Mm-hmm. Yeah, well, that makes a nice mix. You cover all the bases there. I heard you recently expanded hours and days in Leland and I think in Southport, correct?
That's correct. We have offices, of course, all over the county, locations in Leland.
Your main office is here in Bolivia, right?
Correct. The main office is in Bolivia by the hospital on 17. We also have offices in Leland, in Southport, and down in Carolina Shores in the Calabash office. Mm-hmm.
Now, did you expand the number of days in Leland?
Yes. So previously, I think we were covering 1 or 2 days a week in Leland, and we're expanding that now. Dr. Benanati had primarily been in the Leland office, and now I'm going up there. So, as we continue to grow and patient volume continues to grow, we're spreading out and expanding our services in all of those locations.
You're going where the services are needed.
That's right.
And do you find that you are increasing the number of patients in the Leland market there, and they just don't want to drive all this way, and that just makes it easier for them?
I think it certainly makes it easier for them for clinic visits, for office visits. Mm-hmm. Certainly, things they have to come to the hospital for are not nearly as frequent. So, and I think they appreciate being able to stay a little closer to home. And of course, the Asberries have a huge office up there with Oceanside Family Medicine, and
that's great.
And so there's a lot of patients that are out of that office, and we're right next door, so that's
a beautiful new office that they have. And I believe that Brunswick Surgical is now in with Novant Health OBGYN, correct? That's the space you're occupying.
That's correct.
Them.
Yeah, we're right there.
You share that space
in
now.
The same building. That's correct. Yeah.
Mm-hmm. Yeah. Well, that makes it convenient for the patients for sure.
Absolutely.
Now, I know that you focus on a wide variety of general surgeries. So tell me about the types of surgeries that you do personally.
Sure. So again, break it down by body system. If you talk
Yeah.
about skin and soft tissues, we do a lot of skin procedures that can be anything from little minor lumps or bumps, what I call lumps or bumps, lipomas, skin lesions, things like that we do in the office, all the way up to skin cancers, melanomas, squamous cell carcinomas of the skin, lymph node procedures that oftentimes are tied in with those types of cancer surgeries for the skin and soft tissues. We also do a very wide variety of fully encompassing breast practice. So
Okay.
that includes, monitoring with imaging of breast disease, so mammograms and ultrasounds. It also includes biopsies, both in the office and at the hospital, and then procedures, if necessary, for breast disease. Moving on to inside the body, if you think about the GI tract, so we do a full range of procedures from endoscopies, which include EGDs and colonoscopies, stomach surgery, small intestine surgery, colon surgery or large intestine surgery, and then of course anorectal diseases, which includes things as significant as cancer and things as simple as hemorrhoids, which aren't always simple, but
Yeah.
certainly things we all take care of, completely there. So. In addition to those types of things, we do hernias. So that's a very common problem for people. They form hernias either from old incisions or naturally occurring hernias. We fix all of those in a wide variety of techniques and technologies that we use. And then, of course, simple things like gallbladder surgery that most people are familiar with.
Yeah.
We also do emergency surgery. So when something comes into the emergency room, one of us is on call, and that may be perforated ulcers, it could be diverticulitis, it could be emergency gallbladder surgery, appendectomies for appendicitis, things like that.
You touched on cancer surgeries. Tell me how you orchestrate the aftercare of that, so to speak, like oncology and
Sure.
radiation.
Sure. So, anytime we're talking about an oncologic procedure or a cancer diagnosis, cancer surgery, things are very well organized. There's very clear gold standard guidelines that we practice by.
Right.
And so we do that in coordination with oncologists and radiation oncologists and oftentimes radiologists and pathologists. So think of it as a whole team that comes together and takes care of one diagnosis. We have a tumor board that meets frequently, and that allows us to sit down and discuss certain cases with all of those people in attendance to come up with the appropriate treatment strategy and game plan to how to manage, for how to manage each individual diagnosis. We work very closely with the Zimmer Cancer Center, which is part of New Hanover, which is now part of Novant.
Yeah.
We also work closely with the radiation oncologist, which is also part of the New Hanover medical group. So, it's very easy coordination among all of those providers, and it's fairly seamless for the patient.
Wow. I think with the acquisition of New Hanover, it just made things more seamless. I think it's going to be a great thing for the residents of Brunswick County.
Absolutely.
Well, I hate to tell you, but we are out of time. And I had so many more questions to ask you. Promise me you'll come back.
I will. I talk a lot, so I can use time up pretty quick. Sorry about that.
Well, that could be a good thing. Well, thank you so much for coming. We
Sure.
really appreciate it. And I look forward to seeing you again really soon.
My pleasure, June. Thank you.
Thank you.